Thank you, Chairman Rubio, Ranking Member Boxer, and distinguished members of the subcommittee. We really appreciate the opportunity to testify today on the State Department's response to the Zika virus outbreak. I have a longer statement that I would like to submit with your permission. With regard to the current situation, 40 countries and territories in the Western Hemisphere are experiencing active mosquito-borne transmission of the Zika virus. Several countries and territories in Africa and Asia are also experiencing outbreaks for the first time. Since this epidemic began, science and medical experts, my colleague Dr. Frieden, foremost amongst them, have discovered the truly heart-wrenching impacts that this virus can have on its victims, and particularly on developing fetuses. As you mentioned, Mr. Chairman, this is a silent outbreak. We do not see hospitals full of ill patients or hear ambulance sirens in the street. Across the hemisphere, pregnant women and their partners are living in fear that their child may be born with severe developmental defects. In addition to the tremendous emotional and health toll of this epidemic on families and communities, the demographic and economic consequences are still emerging. The cost of lifetime support for children affected by Zika, as well as adults experiencing Guillain-Barré syndrome or other neurological effects, could significantly tax national health and education systems. Areas with high poverty levels and dense population are most vulnerable to Zika, but least able to manage the consequences. The U.S. government is committed to helping prevent, detect, and respond to the Zika virus both at home and abroad. Countries around the world look to the United States as a leader in global health security, and we are working with countries in the Americas and beyond to provide tailored support. Many countries in the region have governments and strong public health systems capable of mounting a response to Zika. Countries such as Brazil, Panama, and Colombia host respected research institutions with which we are partnering to learn more about the virus and develop countermeasures. Through regional institutions such as the Pan American Health Organization and the Organization of American States, the U.S. government and our neighbors are leveraging our collective expertise to share best practices and identify innovative tools for vector control and disease diagnosis. In countries such as Haiti, El Salvador, Guatemala, Honduras, and the Dominican Republic, the United States is providing more direct assistance to effectively respond to the Zika virus threat. Our embassies are working closely with these governments and international organizations, such as the World Health Organization, to identify capacity gaps and prioritize assistance. U.S. voluntary contributions and other support to our regional and multilateral partners enable us to leverage U.S. funding and amplify the impact of our efforts. In addition, public-private sector partners can help respond in areas where the U.S. government has limited access or resources. And today at the State Department, we hosted an excellent public-private partnership event on just this topic. The State Department is committed to protecting the safety and security of all U.S. citizens. This also means working with other governments to attack the Zika virus outbreak at its source. By cooperating with other countries on Zika public health emergency response and planning, we help build a stronger global response to protect U.S. citizens and the international community while contributing to international stability. If we can control an infectious outbreak quickly, either at home or abroad, we help limit its impact on U.S. citizens. So we are working with other governments to increase surveillance and diagnostic capacity, to scale up vector control and to cut off the transmission cycle. We are pushing out across multiple platforms the information needed for our citizens and nationals to make informed travel decisions and to help to protect them from contracting Zika while overseas on the basis of CDC guidance. This is particularly true in the case of the Olympics in Brazil, where we expect over 100,000 U.S. citizens to attend. And Brazil is working very hard to protect the health and safety of all athletes and spectators attending the Olympics and Paralympics, including through its own public awareness campaigns and vector control efforts. Zika, like Ebola before it, has highlighted how interconnected we are as a global community. We have a window of opportunity to address the urgent needs now before we put it further risk by working with our international partners and reaffirming leadership in the region. As Secretary Kerry said at the Global Health Security Agenda Summit in 2014, in an interconnected world, we invest in global health, not simply as a matter of charity or as a matter of moral responsibility, but we do it as a matter of national security. Thank you for your consideration, and I welcome the opportunity to answer any questions you may have.